Imagine with me a child's room. This room is filled with things that they love. It has toys everywhere from a busy day of play, art hung on their walls from years of their creativity. Siblings and caregivers are just a few feet away, and they have established and comfortable routine. Now imagine that child going into the hospital. Monotone bed sheets, being poked and probed by unfamiliar faces continually, loud machines that beep and are always have lights on them. This can cause a child to have severe anxiety and fear. Since 1917, a variety of different play programs have been developed towards hospitalized children. Today, this community is called Child Life. Their role is to seek to help provide family-centered aid, patient coping, play therapy, and to ease that fear and anxiety that children face when they go into the hospital. These services occur throughout the hospital and based on the child's needs. Generally, Child Life will work with children in hospital rooms and treatment rooms, aiding them through the procedures, as simple as having their blood pressure read to an pre-operating procedure, explaining to them the surgery and what they're about to have. One of the large roles that Child Life has is providing areas of normalcy, and this area is the playroom. As we think of a child in their natural setting, there is definitely a role in the aspect of play that they have. From birth till school, in a sense, that is their job, is to play. Using imagination and the resources around them, children are able to explore. This is a gateway for children to express not only their personalities, but also how they are developing. There are four main concepts of play to satisfy the child's needs. That is, that it can be pleasurable and enjoyable to them, that it's going to meet their intrinsic goals, the goals that they have set themselves, that it's spontaneous and voluntary, and that it is an active engagement and that there's a reaction produced from it. When placed in a hospital, this act of play is often interrupted, from schedule interruption and possibly being bedbound to working with the new injuries or disability that occurs. Many hospitalized children are often forced to learn how to play again or different ways to play with the new setting. A hospital playroom not only provides an area for children to socialize, but also gives them space outside of the hospital room to bring a piece of normalcy into their time. Playtime can be guided by a Child Life specialist or an independent play. Cooperative play with other children in the playroom. The children in the playroom will generally be family members, visitors, or other patients. Playtimes will provide a variety of different mediums in which play can occur. Whether it's through avenues like art, toys, music, games, dress up, patients are able to work with these to calm their anxiety through their stay and adapt normalcy into their setting. These playroom times are a great time to begin to build the aspect of trust with patients and to help in guiding and making patients more comfortable in their time of one-on-one distractions and play sessions with Child Life specialists. Child Life specialists are certified individuals in guiding patients through their journey in the hospital and their sources of distractions and play methods. Distraction methods are purposed in having patients focus on something outside of their procedures that are currently taking place. A big thing that is used in distraction methods is bubbles. Bubbles prove to first calm the breathing of the child, and second, to also have something for them to follow around the room so they're not focused at looking at what's happening maybe to their arm or what the doctors are doing. I Spy books are another great thing. We all remember our Where's Waldo books from growing up, and it's a mass scene of chaos, and you have to find that one object. This is a great distraction for children so that they're not looking at what's going on, but they're focusing on that book, and it gives it's a little harder, so it's great for older patients. As technology grows, iPads are also becoming another great way for distraction methods to occur. It's more of a cause and effect based, meaning there's an action that takes place by the patient and then a reaction that happens on the iPad. And this can be very entertaining for them. Preparing before distraction is important in building trust and letting the child know what is going on so they can become comfortable. A child life specialist will describe the procedure that will take place and in many cases will act it out on themselves or with stuffed animals. If the specialist sees it appropriate, caregivers can be incorporated into distractions, but often they are too emotional and may cause a patient to become more upset. Specialists seek to involve siblings and caregivers as much as possible into the services that are given to provide a comforting environment for the patient. Birthday parties, first steps, holidays, family events still happen even though a child is in the hospital. Child Life seeks to recognize all these events and provide regular opportunities for entertainment around the hospital. Special guests are a great way to break up the day-to-day and allow patients to express something that is out of the norm in the hospital bubble. Playtime is another huge activity. Not only does it provide time of play, but it also provides a time of building community among the hospital. Many caregivers can feel alone for this time, and providing playtime is another chance for them to become in contact with other caregivers and to build relationships with them. Child Life Services is a great piece of the puzzle that is the healthcare system today. Through Child Life, patients are able to have a little piece of normalcy and learn ways to cope with the life of being in the hospital. Their services to each patient will help them feel more at home within the hospital and transition home when they are finished with their stay.